So here's the question. Does mankind really have the power to throttle the spread of a virus like this? Serious question. Do we even have the power to alter the course set by Mother Nature for this Wuhan virus? The Wuhan coronavirus is spreading, just like viruses do, slowly, surely spreading. Why should we be surprised when densely populated metropolitan areas get hit hard? It's a virus. Joining me now from St. George, Utah, emergency medicine physician and chief medical officer at Remote Health Solutions, Dr. Jonathan Baugh. Doctor, you surprised at all when you look at the chart, when you look at the map of the United States and you see certain pockets of outbreaks of the coronavirus, and we look in New York and we look in downtown Manhattan and New York City, that there's a high concentration. Effectively, it's the epicenter now for the outbreak of this virus in the United States. But it's a densely populated area. It's the most populous city in the United States. So why should that surprise us?
Yeah, Graham, thanks for having me on. I appreciate your time. You bring up a really great point. Not only is the density one of the contributing factors because of the highly transmissible nature of this COVID-19, but also the fact that these areas, these epicenters in California and New York are also a big area of influx of people. It's the centers of travel as well. So you're exactly right. The nature of the virus is one of the things that is making these densely populated areas much more prevalent with the COVID-19.
And when we look at, and by the way, that would be the case with any kind of virus, right, doctor? Before we move on here, this would be the case if it was the flu or any kind of communicable virus that can be spread through a cough or through a sneeze or through touching a person or a surface, right?
Yeah, it is. The one difference is this virus is more highly transmissible than others, but the same principle applies. You're exactly right.
It's about 2x. They're figuring about 2x, maybe 3x more
3x.
contagious than the regular so-called flu. But when we look at the numbers right now, and we have the latest numbers in the United States rounded off, we have about 46,500 cases and 600 deaths. And the mainstream media, many of them are out there apoplectically saying, oh, look at the number of deaths going up. But it's interesting because I'm a number cruncher, and you look at the mortality rate of this, and it's now at or below 1% when you crunch these numbers. So we're out there testing more. And can I ask just kind of a common sense question? Obviously, this virus is hitting a susceptible group more than others, right? These are people who are elderly and with underlying health conditions. Is it not possible that these same folks might have succumbed to the seasonal flu just as well as this virus?
Yeah, Graham, that's a great question. I mean, what we know is the seasonal flu kills 20 to 60,000 people every year in America alone. So that point is not lost, absolutely, on healthcare workers. And the issue that we've looked at as healthcare workers is, well, what's different this year? What's the difference about the COVID-19, the SARS-CoV-2 virus, and how can we stop the spread of it? But yes, it is reasonable to think that the same patients who are succumbing to COVID-19 might have succumbed to influenza seasonally. It's tough to be able to know for certain, but that's definitely a possibility, absolutely.
Again, if we look at the numbers in South Korea, for example, South Korea is apparently an example of getting this thing under control. It's been stuck around 8,000 or 9,000 cases for several weeks now, and the number of deaths relatively small, 120. You're talking about, though, a population of roughly equivalent to the state of California. So it's not exactly 330 million people like the United States. It's around 30, 40 million people in South Korea. That said, apparently they have flattened the curve. But the question is, in your mind, in your study and what you know, does mankind even have the ability to, quote, flatten the curve like we are trying to do? I mean, maybe a little bit here and there, or is there really a methodology? Is there a method to the madness that we're spreading across the country right now, or is this fantasy?
That's really tough because I don't know that we've ever had before this COVID-19. I don't know we've had an example like this. This is sort of unprecedented as far as how we've responded. We can look at the different areas around the world, and we can look at the mortality rates, and we look at how they flatten the curve. If we look at Italy with its 9.5 or 10% mortality rate, what did they do differently than South Korea? What did they do different than the Netherlands, and what are we doing differently here? Can we flatten the curve? The best minds are saying that they think that we can. So I think that we need to keep that in mind as we move forward. How can we help prevent disastrous outcomes?
Yeah,
obviously that has.
Mankind always wants to do that, right? And we want to be able to predict an earthquake, but we still don't have that kind of technology. And I hate to be a little bit on the skeptical side, but it's part of my job here. But you are involved in telemedicine, and telemedicine is now playing a huge role in this outbreak right now, because what doctors are saying is, hey, don't come into the office if you have, if you feel sick. Wait until we kind of figure out at arm's length whether you have the virus. You've been consulting with the White House through this crisis, have you not?
Yeah, our company, Remote Health Solutions, has been in the White House on Capitol Hill, I think about 30 times over the past 5 weeks, because we were able to see early on that there needed to be an additional way to contact, treat, and monitor patients. And so the way that telemedicine has changed, President Trump was announced early that telemedicine was going to be one of the great answers for helping here with COVID-19. And so our ability to monitor patients early and often and help turn the curve of individual patients' lives is one of the key things that we can do with telemedicine. And I think if I speak directly about my company and the technology that we use, it's more than a FaceTime chat. So we think that is fine, a FaceTime chat to be able to reach out to your primary care physician and say, should I come in or should I not? But when we start looking at more advanced technology, can we see and evaluate a patient remotely? Can we monitor them in their homes and keep them out of the hospital? Can we monitor them in an EICU, in a telemedicine ICU, and keep their distance from healthcare workers and other patients, put everybody at lower risks? So yeah, I mean, it's a huge part.
And you're looking for certain symptoms, right? I mean, in certain cases, this corona appears to mimic the flu, but then there are other telltale signs. We're hearing possibly some people suffering from digestive problems well before they actually show major symptoms of corona. And now we're hearing that some folks are losing a sense of taste and smell. Are you coming across this at Remote Health Solutions? Are you coming across any diagnoses like this, or any patients who do indeed officially have corona?
So you bring up a great point. The standard three, the fever, cough, shortness of breath, and even the other, some of the, as you mentioned, telltale signs, GI upset or other smaller symptoms, those can be found in a myriad of other viruses. And so it's hard when you just examine a patient without a test. Is it going to be different than any other virus? Really, probably not. Yeah. The issue gets to be with, can we provide a test that identifies that, and can we do that rapidly so the turnaround is fine or faster, so that we can have a better outcome and less spread?
In other words, you're limited. Obviously, you're limited. You have a partition between yourself and the patient, but you play a crucial role here in weeding out and taking the burden off doctors and hospitals. And the website is rhsusa.com. Dr. Baugh, thank you. Coming up next, the huge coronavirus spent